Hey everybody, welcome back. It's the Morning Rush on Z1063. Hit music now. Danny Golden here, and we are hanging out today talking about one of my favorite subjects. I'm just like in nerd heaven right now because I'm talking to Dr. Martin Rutherford of Better Healing in Bernalillo, and he is a doctor of Oriental medicine, so similar to or the equivalent of an internal medicine doc, right? So you treat pretty much everything. I mean, there's so many things that we've talked about, treating with acupuncture, herbs, cupping. But I just want to make sure that we're not leaving anybody out of this conversation because some of the conditions that we mentioned earlier on kind of present themselves at an older age, but there are several conditions that, people in their 20s and 30s experience that acupuncture can benefit as well.
Indeed. The first thing that comes to mind is actually menstrual pain. Mm-hmm. In Chinese medicine, there's a belief that you do not have to suffer, that your menses should be pain-free. Yeah,
okay. So in acupuncture specifically can help with that.
Actually, acupuncture is used as an adjunct with herbs. It is definitely an herbal approach.
Okay.
And can take upwards of about 3 months of care. Okay. But then things
then you're
out.
Good from there. Yeah. So, and it not only treats the pain, but I imagine some other symptoms surrounding, as far as our mood is off, because the hormones at that time are doing, things they're supposed to be doing, but wonky things nonetheless. And
Indeed.
So, does that treatment help with those auxiliary symptoms?
Certainly. Yeah. Irritability is almost instantaneously relieved as a component of acupuncture.
Oh, nice. Yeah. I think that's a big one. I think most women, if not for the person, for the people around that person, they're like, you go see Doc Martin, girl, because you're having some issues this month. But yeah, so definitely, if that's something that's a big bother, because that can be a big bother for a lot of women, the heaviness and the cramping and things like that. But for men as well in this age range, what do you feel like is a very, common thing that you treat within the, 20, 30s age range?
Actually, in that age range, it's either like car crash injury or it's exercise-related injury.
Oh, okay.
Pulled muscles, ligament and tendon injuries, and things along these lines. And ligament and tendon injury in particular is a concern from the Western side because it takes somewhere between 4 and 9 months for pretty much any injury.
Yeah, to heal that up.
And we have some herbs and things that we use that could potentially shorten that by
by a lot. And it's good that you mentioned that too, because on one of the last segments we were talking about, I was asking you, personally about your philosophy and there are a lot of people that maybe practice, other methods outside of Western methods of healing that would say, throw that out, and then there's people within the Western medicine community that say, oh, that stuff is phooey. So, we were talking about using those together, joining both of those aspects.
The best possible outcome is concurrent use of both Western and Eastern approaches.
Yeah.
I actually volunteer with UNM's Chronic Pain Echo.
Okay.
That's a group of doctors who come together to discuss difficult cases for people who have been dealing with chronic pain, and this is for all ages, young to old.
Wow.
And they are very surprised with some of the things that I'm able to provide as a method for treatment.
Yeah, well, definitely, I think we should definitely talk about that. If you're out there and you're listening and this is something that piques your interest and you want to get some relief, please don't wait. Reach out to Dr. Martin Rutherford at Better Healing. The number to call is 433-7307. We'll be right back on the other side of the break with more. It's the Morning Rush on Z1063. Hit music now.